share of the cost growth attributed to prescription drugs. Over the past 3 decades, prescription drugs have doubled as a share of healthcare and expenses. These prescriptions, on the right side, they've significantly improved quality of life and duration of life, but they come at a significant cost. Adults in North Carolina have gained coverage as a result of this provision in the ACA. So let's talk a bit about how the health law actually affects another important group, small business owners. If you're a small business owner, you know it can be a challenge to be able to offer health insurance to employees. Under the health law, more choices will be available to small businesses. Small businesses may also qualify for some tax credits. So I'll start let's start with finding health insurance for employees. Small businesses that do not currently offer employee health insurance will have more options in the future. Starting in 2014, businesses with up to 100 workers may be able to buy that insurance for their employees through the new healthcare exchanges. Mike touched on the healthcare exchange, and I'll elaborate some more on that as we go forward. All of those plans through those exchanges must include core benefits, such as coverage for medical, mental health, and prescription drugs. Not to get off onto the subject of gun control, but a key part of that gun control debate that's starting to happen includes, well, what do we do about mental health? Well, mental health will receive a lot more mental health services will receive much more offering to the population through the Affordable Care Act and then through Medicaid expansion if that was to happen. Plans cannot refuse a policy because of a person's health condition. So what happens if you're a small business owner and you don't offer employee health insurance? Will you be required to actually offer it? Well, that depends on the number of people who work for you. If you have fewer than 50, you will not have to worry about paying a penalty if you do not offer health insurance. But starting in 2014, businesses with more than 50 employees may have to pay an annual penalty if they don't offer coverage. And on this slide here, I'll mention that there's some really good news, for small business owners. You may be able to get the tax credits to offset part of the cost of offering health insurance to your employees. It's estimated that 2.8 to 4 million small businesses will be eligible for those credits. The amount of the tax credit, it actually depends on how many employees you have and their average wage. So to be eligible for a tax credit and you have 25 or fewer employees whose average annual wage is under $50,000, and you must pay for at least half the premiums for the health care coverage for your employees in order to receive that credit. Other benefits for businesses that you should know about. Businesses with up to 100 employees can now offer what are called simple preventive care services. You'll also be able to work with your doctor on a personalized prevention plan to keep you healthy as possible. That means that problems can be detected sooner and treated more quickly and hopefully cost less. The additional preventive benefits started in 2011. The benefits include a yearly wellness visit, screenings for diabetes and certain cancer, includes mammograms, colonoscopies, and other preventive screenings. Secretary Sebelius, the Secretary of Health and Human Services, can actually add more tests or screenings or health counseling if they deem that it's necessary. You won't have to pay co-payments or deductibles for those Medicare-approved preventive care services, and screenings that are currently available, such as pap smears. My mother would never think I would say that in front of so many people. But anyhow, those types of things and prostate exams will continue to be available. The new preventive services are in addition to the free Welcome to Medicare checkups that people get when they start their first year of Medicare. So if you have a Medicare Advantage plan, check your plan to see how they're offering, but bear in mind that there are some guaranteed minimum benefits that Medicare Advantage plans have to offer. Moving over, primary care doctors. Like most people with Medicare, you want to be able to ensure that, if you actually continue to get quality care. And you want to know that primary care providers are actually going to be there to give you that care. So the law addresses some of those needs. Primary care doctors who treat people, now the percentage is less than that of actually how many are open, but there's that 10% bonus payment. So in areas with doctor shortages, Medicare will also give extra payments, to physicians and nurses who provide primary care. This will encourage doctors and nurses to serve in underserved communities. Provides an education incentive for people to train into the healthcare practitioner fields where there are shortages or underserved populations, or to help build a primary care workforce, especially in underserved areas. Now, because of time and the amount of coffee that may have been consumed earlier, I'm going to just move past the Medicare Advantage plans. And those of you who have Medicare Advantage, if you'd like, we can talk about this after this is over. Let me mention, just move over to people receiving long-term care. We're often concerned about that. So, back up. Some more info is now available on nursing homes. It will make it easier for you to select a nursing home. You can go to this website and compare. But now you'll be able to get info about who owns that nursing home, how much the nursing home spends on resident care compared to admin costs, the staff turnover rates and complaints and violations. And if you heard in the newspaper this past weekend about Montgomery County's nursing home that unexpectedly closed and put many residents out on the street, well, you'll appreciate that the ACA makes nursing homes owners provide much more transparency about their operation, and if they're going to close, that they have to provide sufficient forewarning. Residents and families must be told of that closure far enough in advance so they can make other plans. So quickly, other changes to Medicare, the Part D, that income, there are some income-related premium changes. So people with higher incomes, currently you pay a higher premium for Medicare Part B if your income is above that level. So $85,000 for singles or $170,000 for married couples. Income-related premiums also apply to those who have Part D prescription drug coverage, and that went into effect in 2011. A major part, and this is my wrap-up here, a major part is what the ACA does for reducing waste, fraud, and abuse. Billions of dollars are lost each year to these types of inefficiencies. But what Medicare, to make that long-term stability for the program, the ACA puts a significant amount of money to aggressively crack down on waste, fraud, and abuse, including adding $350 million for healthcare fraud and abuse control fund and providing for coordination between government agencies. It will also help cut inefficient care, identify fraudulent providers, reduce overpayments to insurance companies, and protect the privacy of consumers' personal info. And finally, let me just kind of wrap up and say the truth about those ACA Medicare cuts. There are no cuts to guaranteed Medicare benefits. So despite what you may have heard during the campaign last fall, no cuts to guaranteed Medicare benefits. Beneficiaries are better off because they now have prescription drug coverage where they didn't have before the ACA. That's the closure of the donut hole. And because the ACA Medicare patients who do not pay deductibles or co-payments for certain preventive care, appointments and tests, the catastrophic limits and insurance denials are prohibited. And now there's much greater effort to prevent and combat fraud, waste, and abuse. So those reformed healthcare business models reduce the waste and inefficiency. Show you right here, the healthcare law, it's going to be phased in over several years. Many changes will be happening as regulations come out. We're going to keep you informed. The best way to stay informed is to stay at this particular website because it's constantly updated, and it's the guide with a one-of-a-kind tool that explains what the healthcare law actually does. And it's in English and in Spanish, and you just put in a little bit of info. Okay, it gives you the report at the end. AARP.org/health law guide. So I hope the presentation gave you a better understanding of how the ACA helps people and helps reform the healthcare business model. It certainly stimulates a lot of reforms to the business model. I could have spent hours more talking about accountable care organizations and patient homes and community care homes and other new models that are coming to reform that healthcare delivery. But the result is more patient-centered outcomes, more risk sharing, and improved incentives for quality care. The best part, however, is approximately 800,000 more North Carolinians will have peace of mind that if they get injured or sick, they'll have the medical care that they need. This transformation in healthcare delivery is not simple by any means. We noticed all those regulations early on. It's not simple, it's very complex. But it is definitely necessary if Americans want to rely on affordable and accessible healthcare coverage as they age. So thank you very much for your patience. I'll be happy to take some questions as we get into that period. Congressman Pittenger, thank you again for hosting this.
Doug, stay up there, please.
Yes,
yes thank you.
Just a minute that Chris is going to moderate. Look, as you may have seen, I rushed in here without my notes, left them in the car. I winged it. You know, when you wing it, sometimes you fly into a wall. But I would be remiss not to thank those who really made this happen. Of course, Dr. Zeiss and your team, I really appreciate all that you all have done. Also, would like to thank the Chamber of Commerce and Carolina District Review, Chris, Presbyterian Hospital, and of course AARP, the National Federation of Independent Business, Cato Institute, and Carolina's Healthcare. I'm grateful and indebted that you would put your name on the line and reach out to those who are part of your organizations to allow them to come and be better informed. So I know some of you have to leave, and I really want to make sure that these good folks are thanked. Appreciate it.